when you pull, you're gonna pull with your body, and you should allow the arm to move this way, okay? Not that way or that way. So your hand will be here, and when you pull here, you just give just a little bit off here. Reach to here, you have pulled already, now you're gonna use the resistance. Say, push at my hand, if that's the painful movement, and relax, okay? If it's painful, you need to change your line of pull. So you may need to go forward with your body, you may need to go a little bit backward, you may need to go to this side or to this side. Or, very common, while you are putting the belt, it glides away from the joint line, so it's here, or glides up at the joint itself. So that's not going to be very helpful. Okay? Now I'm going to do the technique as we would do it. Just break with it for me. To put the belt here, because you are going to pull with your body, keep some distance if you're standing straight between the belt and the arm. The belt is on the shoulder closest to the person if you are standing in this direction. Put your arm in, at the joint line, put it back, in the same position, slightly rotated and pronated. Place your arm as we talked about, and now you apply your glide. The glide is quite a strong glide, it's not a soft glide, and it comes from your body, just like that. Is this okay? So you ask if it's okay. Yes? Now you ask him to put some resistance, as we did before. Push and relax. If he pushes and it's painful, push, ow, okay. Now I adjust as I told you before. This side, this side, this side. I double check, is it on the joint line? Adjust, try again. Okay, now it's pain-free. Okay, or almost pain-free. You look for a pain-free one. Sometimes it's not pain-free because he's pushing even more than he did before. So that becomes a different story. But he should push the same way as you tested. So push, push up. Okay, not that quickly. Push up and relax. This should be pain-free, and we repeat it. I'm gonna lift his arm so you can see what we are doing. Push up and relax. Push, relax. And you do that as long as it's pain-free. If he suddenly gets pain, you stop. That's the limit. So if he reaches 7 repetitions and now he says it's painful, you stop. Then you do it again. You realign, push up, relax. Push up, relax. If it hurts you, let me know. You repeat that a few times. Similarly, if the movement was pressing on something, so he will do that instead. Okay? Now, just one tip for the girls. If you're treating a strong person and you're saying, push your hand back, push up, and they push so hard so they almost break your wrist, okay? So you can avoid that. The way you can stop them from pushing too hard, close your hand. When they push, they hit this, and they don't like it. Push up if you like it. They don't like it because that hurts, okay? So you can put your hand this way, protect your wrist. Okay? So push up, relax. Push up, relax. Push up, relax. Once you have done like 3 sets of 6, 7, 8 repetitions, you may be surprised by having him bending, unable to bend, because suddenly bending is painful. It wasn't painful before. Now we treat it for the tennis elbow. This movement is not painful, but now he cannot bend. I don't know if he's going to be happy or sad, because before he could at least bend his arm. So we know this happens sometimes, so you warn the patient. You finished your 3 sets now. Then you say to the person, sometimes when we do this, people notice that they have difficulties with bending, or it hurts when you bend. So don't worry about it, because we can change it immediately. We are just not going to test if this is the case for you. I want you slowly to bend this elbow slowly in this direction, okay? And if you get pain, let me know. Then you relax the belt and you start bending them in this direction slowly. And he says, ow, it hurts here. If it does, now you do exactly the same in this position. Yeah, this is the position now. You mobilize and you ask him to do the same movement what he did before. Push up, push, and relax. Just few of these. Push, relax. Few of them, and then you get back here and you retest the same movement. Maybe there was no pain, but when he reaches to here, he gets the pain again. Now you do it again. Push and relax. Push and relax. Just few times. And relax. Bring it back. Release the belt and test the same movement. If there's nothing here, you can take it out. Okay? Now you're done. Against the wall, you can see it. If you were quick to take the belt, you did 3 mobilizations, and you are quick to take the belt away. Try to explain that to them.
Если вы были слишком быстрыми и убрали слишком быстро пояс,
So I did that many times.
я делала так много раз.
I'm in a hurry, so I
Я
finished
спешу,
this,
я
I
закончил,
pull the belt away, and I
убрал
turn
пояс,
around,
поворачиваюсь,
and I can see the person.
а я вижу, что человек в шоке.
Okay, so he's sitting there,
Сидит,
bend his arm.
не хочет говорить, но он не может согнуть руку. Что вы делаете?
Exactly what I showed you before.
То же, что
Okay,
я
turn
показывала
around,
вам ранее.
face this way.
Лицом к нему.
Yeah. You do exactly what we did before.
Делаем
for
то же
flexion.
самое, что делали для флексии
Okay,
ранее.
And extend, bend, extend, and if it's extension, you do that. Okay? If he's still lying down,
Если он все еще лежит, можно делать лежа.
this is your glide, this is your stabilizer, bend and extend. Over pressure, bend, push it down with the other hand.
Надави рукой, другой рукой,
Down with the other hand.
другой рукой.
Not on the hand.
Не на руку,
longer down.
ниже, ниже опусти руку свою.
Like the wrist. Longer down. Yeah. Okay? You got it?